Hi everyone. In this video, we will be reviewing the condition of dementia, reviewing stages and types of dementia, and covering remaining abilities and effective strategies to work with individuals who have dementia. So, dementia is an umbrella term that refers to a condition with symptoms such as loss of memory, language, problem solving, social abilities, and other areas of cognitive functioning. There are 7 main stages of dementia, and we have included them on this handout. The stages begin at stage 1, which is no memory deficit or no cognitive decline, and progressively get worse until reaching the last stage, stage 7, which is very severe cognitive decline or severe dementia. In between stages 1 and 7, we have stage 2, slight cognitive decline, stage 3, mild cognitive decline, stage 4, moderate cognitive decline, stage 5, moderately severe cognitive decline, stage 6, severe cognitive decline. In stage 1, there are no symptoms present. In stage 2, you begin to see some symptoms of slight forgetfulness, such as forgetting names or forgetting where an item was placed earlier. In stage 3, symptoms become more apparent and you see more trouble with concentration, organization skills, time management, and challenges with complex tasks and chores. Stage 4 is moderate cognitive decline with more memory challenges, and an individual has trouble completing tasks independently. There is often social anxiety and denial of assistance during this time as well. In stage 5, major memory loss is observed with periods of confusion and help is required for completing daily tasks. So some examples are the individual may have trouble picking out clothing for certain weather and will be unable to do basic addition and subtraction. In stage 6, an individual will forget names of close family members and friends, experience incontinence, which is when they are unable to control their bladder, have difficulty with speech communication, experience emotional dysregulation, experience sleep disturbances, have episodes of compulsive or repeated behavior, show agitation, and they may wander or elope. In the final stage, stage 7, an individual usually loses all ability to communicate and eventually will lose the ability to swallow. They will need assistance with all activities of daily living. They may have more angry outbursts and overall will need 24/7 care. So those were the different stages of dementia. And next, we will be going a little more in depth into the different types of dementia. These include Alzheimer's disease, frontotemporal disease, vascular dementia, and Lewy body dementia. Other neurological disorders with similar symptoms include Parkinson's disease and Huntington's disease. So first, Alzheimer's disease is caused by deposits of the protein fragment beta amyloid and twisted strands of neurofibrillary tangles, creating nerve cell damage and death to brain tissue. Symptoms of Alzheimer's include progressive worsening of memory and ability to communicate and care for oneself and home. Frontotemporal disease is caused by shrinkage of the nerve cells in the frontal and temporal lobes of the brain. Symptoms of frontotemporal dementia include difficulty with personality and behavior changes, and difficulty with language skills and movement that worsen over time. Vascular dementia is caused by stroke and any other conditions affecting blood vessels in the brain. Symptoms of vascular dementia include impaired judgment, difficulty with the ability to make decisions, and plan or organize thoughts. Lewy body dementia is caused by abnormal aggregations or clumps of protein alpha synuclein in the brain. Symptoms include memory loss and thinking problems that are similar to those of Alzheimer's. However, initial or early symptoms such as sleep disturbances, well-formed visual hallucinations, slowness in gait or their walking, balance problems, or Parkinsonian-like movement features are most likely to occur. Other neurological disorders with similar symptoms include Parkinson's disease and Huntington's disease. Parkinson's disease is caused by alpha-synuclein clumps developing in the substantia nigra of the brain. These clumps cause the degeneration of nerve cells that produce the neurotransmitter known as dopamine. Symptoms include problems with movement, which are the most common in early stages. If dementia develops, symptoms are often similar to the Lewy body dementia type. The person's face may become fixed or expressionless over time, despite how they are feeling. Depression is also common among people with Parkinson's disease. Huntington's disease is caused by a genetic condition that manifests as abnormalities in brain protein. Symptoms include abnormal or involuntary movements, severe decline in thinking and reasoning skills, irritability, depression, and other mood changes. So, dementia will be perceived differently person to person, and these are just a few facts about each type. As individuals progress through the stages of dementia, symptoms may continue to look different. Something we must also keep in mind is that your client may have other diagnoses that contribute to their symptoms and progression. So we hope that this handout provided will give you a little more information on top of what you already know about this population. At the beginning of this module, we touched upon the 7 stages of dementia. Now, we will discuss what remaining abilities you will see and how you can assist the person throughout each stage. As dementia progresses to later stages, people may have difficulties with memory and concentration, as well as their mobility. We want to optimize on the remaining abilities as it can be helpful to understand what they are able to do in order to engage in meaningful activities. It is important to remember that the remaining abilities should not be viewed as what they can only do, but what strengths or skills they have. When you can, try to draw on these strengths and have clients use them to engage in their meaningful activities. So stage 1 is when the individual has no cognitive decline. At this stage, the individual's abilities to make decisions, remember facts, names, and problem solve through tasks are all intact. They are able to go about their daily lives without needing any type of assistance. In stage 2, the person will have a very mild cognitive decline. During this stage, the individual can solve simple problems, look for items that are missing or out of their view, and learn new things with lots of repetition, cueing, and written instructions. At this time, they may also use checklists and reminders. In stage 3, the person will have a mild cognitive decline, and here they are able to complete very simple and familiar tasks, such as brushing their teeth and getting dressed. In addition, they will also be able to communicate their basic needs or desires. The individual may have some incoordination, but will be able to walk without any assistance. To prevent any falls, encourage them to use things like handrails, grab bars, or walkers if they have one. It would also be beneficial to remove any tripping hazards and increase the lighting in places such as hallways, entrances, and stairs. Stage 4 is when the individual has a moderate cognitive decline, and at this stage, the person has the skills to complete simple tasks and basic activities of daily living. To help them engage in these tasks, the environment should be set up beforehand and verbal cueing should be used while they perform the activity. In stage 5, the individual will have a moderately severe cognitive decline. In this stage, the person can use the bathroom independently and eat independently with an environmental setup. So, for example, clearing the table and only placing their meal on the table with the necessary utensils would be helpful for them. They will still be able to complete familiar tasks, but will need help with sequencing cues in order to complete the task. Lastly, the person will be able to interact with familiar objects that are placed in front of them. Stage 6 is when the individual has severe cognitive decline and will have the skills to communicate with short words or phrases, self-feed with finger foods, and complete one-step directions. While interacting with them, it is important to remember to allow extra time for processing. In stage 7, it is known as very severe cognitive decline, and here the individual will still be able to communicate with facial expressions and respond to all 5 senses that are close to their body. Some responses can include, but are not limited to, vocalizations, sounds, and turning the head and tracking with their eyes.